Hello, I'm Sal Sanders. It would be my pleasure to demonstrate an alternative technique for palpating and targeting the radial artery during arterial blood gas sampling. This is very important because having an arterial puncture procedure done is uncomfortable enough if you manage to get the sample on the very first attempt. And in some cases, if you have difficulty properly palpating and making that initial approach, you may need multiple attempts to get that sample. Most of the procedures for arterial blood gas punctures will show the palpation being done with 2 fingers and the puncture being done just prior to the finger here. Some will have 2 fingers to start with, and again the finger is perpendicular to the artery, which is running this way down the arm. Some will have demonstrated with lifting 1 finger just prior to the puncture. The technique that I'm going to demonstrate is a slightly different technique that I call the Sal technique. So before we get started with the model itself, I'm just going to put some tubing with red colored fluid in here on top of the model so you can kind of get the idea of what we're doing with this Sal technique. And it would be nice if people's radial arteries did lie on top of the skin and you could just see them this easily, but that would take all the fun out of this, really. So when you're palpating the radial artery, you're going to roll your finger slightly from side to side. Again, the finger is single finger technique aligned with the radial artery. And you're going to roll your finger from side to side so that you can feel the curvature of that artery. And wherever you feel the pulse to be the strongest, align the center of your fingernail with that pulse point. So this should be the center of the artery. And then you're going to take your needle and aim it towards the middle of your finger there, the center of your fingernail, and make the puncture just before your finger. By aligning it with the center of your finger, you should be able to hit the center of that artery, get your needle into the lumen of that vessel, and obtain an adequate arterial sample. Even if you should miss by a tiny bit, you'll probably still hit the artery itself and be able to obtain an adequate sample. That's one of the beauties of making sure that you're aligned with the center of the artery. You have a little bit of room for error. So again, take your time, palpate the artery, make sure you can visualize where you want to stick. Roll your fingers side to side, align the middle of your finger with the strongest pulse point, and then use that as an aiming point for your needle when you make your initial puncture. And puncture just prior to your finger, obtaining an adequate sample. That's really all there is to it. And that stands for single finger aligned linearly. So the finger aligned linearly with the artery running in this direction, the finger being placed here, and then slowly rock the finger back and forth until you can actually feel the curvature of that artery. Feel where the pulse is the highest. That should be the center of the artery. And then once you've located that, line up the center of your fingernail with that point where the pulse is strongest, which should be the place where you're at the center of the artery, and then make your puncture at a 45-degree angle just before your finger. You don't want to stick your finger during the procedure. Pretty simple. I used to show this technique to students who were having difficulty getting arterial blood samples, and the technique helped their performance quite a bit, but those were just anecdotal observations on my part. So Dr. Caldwell and I decided to see what would happen if we taught people who were just learning this technique from the start, and not just the folks who were having difficulty perhaps targeting that artery and hitting it using the traditional techniques. So that's the purpose of this video and the purpose of the research project that you're currently involved in. So again, traditional techniques would have the fingers perpendicular to the artery, and in this case, the whole feeling of where that pulse is, at least in my opinion, is spread out over a much broader part of the finger, whereas with the salve technique, when you're aligned linearly with the artery, you can palpate right on the tip of your finger there, line it up with the center of your fingernail, and it makes it much easier to go ahead and hit that artery on the first attempt.